ताज़ा तरीन खबरों को जानने के लिए अभी टाइप करें A1 न्यूज़ टीवी। नीचे दिए गए सब्सक्राइब बटन को दबाएं और नोटिफिकेशन के लिए दिए गए बेल आइकन पर क्लिक करें। हमारे वीडियोस को लाइक, शेयर और कमेंट करें।
Hello and welcome. I'm Priya Dheer and you are watching A1 News TV. StemGenn Stemcell Express organizes with 5th International Regenerative Medicines Conclave 2019 held on aims at achieving new milestones in regenerative gynecology and aesthetics with an aims to create a better and healthy world using modern day technologies such as cellular therapies and regenerative medicines. Have a look.
I'm Dr. Carolyn DeLucia, a board-certified OBGYN from New York, USA. The topic I discussed today is platelet-rich plasma, stem cells, and exosomes, the new frontier in gynecology today. I have been very, very honored to have been invited by Dr. Prabhu Mishra here, who runs StemGenn here in Delhi. This is an amazing organization that is at the absolute cutting edge of all of the regenerative medicine available in the world today. Well, in USA, we have to be very cautious about using stem cells. So we use regenerative techniques such as platelet-rich plasma and exosomes, which are now commercially and minimally manipulated, to try to activate our natural autologous stem cells to grow and heal disease.
So I am Prabhu Mishra, founder and CEO of StemGenn Therapeutics and organizing secretary of Stemcell Express 2019, 5th International Regenerative Medicine Conclave, New Delhi, India. So 5th International Regenerative Medicine Conclave is a totally dedicated 2 days international conference on stem cell, cell therapy and regenerative medicine. As stem cell and regenerative medicine is upcoming field and innovative fields, and this is going to revolutionize the healthcare. That's why this is the latest trend, so much more awareness and knowledge is required in various fraternity. So that's why the theme of the Congress is organized as Advances in Regenerative Medicine in various clinical applications. So 150 plus doctors, researchers and academicians have participated across the globe, and more than 25 international speakers and more than 30 national speakers are here, and they are talking stem cells and regenerative medicine application in various fields like dermatology, plastic surgery, orthopedics, vascular surgery. Speakers are from All India Institute of Medical Science like Dr. Sujata Mohanty, Dr. Shilpa Sharma, from Italy, very renowned plastic surgeon, Professor Dr. Misal Joki. He is also going to talk to you about the advances in regenerative medicine. Dr. Aonenewstv from USA, Dr. Caroline DeLucia, Dr. Ena Galeva, and very renowned other scientists and speakers have participated in this conference. Of course, stem cells, this is not today's science. Stem cells, like till date, like bone marrow transplant is widely known for cancers and blood related disorders like hematopoietic stem cell transplant. For non-hematopoietic applications, now various area of medicines are coming up with stem cell treatment. It's from your own body's bone marrow or fat or the peripheral blood or the cord blood. These all are the sources. So this is the master cells which are responsible for rejuvenation, regeneration, repair and restoration of damaged cells and tissues inside the body. So this is basically, you can say, most natural way of treatment, and the message is the healing kit is inside you.
So my name is Natalia Kashuba. I'm a doctor of medicine and doctor of dental surgery. So in my clinical practice, I'm trying to combine all my professional skills and to treat patients holistically, to take care of the general well-being of a patient. So currently I'm specializing in psychiatry, which is outside of stem cells, but not that much, especially in old age psychiatry. If it comes to dementias, there's quite a lot of research actually aiming to use stem cells, and as well basic sciences, so inflammation and so on. And in this case, dentistry also comes as something common in this case because of focal lesions, various infections within oral cavity. It all affects general well-being and mood as well. I have also particular interest in nutri-psychiatry, so diet can be the source of better mood as well as of longevity, and can lower inflammation markers as well. So I'm trying to combine everything, and that's why I'm here today.
I'm Dr. Shilpa Sharma. I'm working as an additional professor at the All India Institute of Medical Sciences, New Delhi. So I'm speaking on the effect of stem cells in neurological diseases. We have given stem cells in some patients of meningomyelocele. These are patients who are not able to walk since birth. They have a defect at the spinal cord at the back, and they have neurological deficits. They have a neurological bladder and bowel, and stem cells can help them to recover their losses. We've also used stem cells for polio patients in 5 patients who were not able to walk properly, and we have injected stem cells long after they had their disease, and we have seen dramatical recovery in them. Yes, this topic is very useful because it is still in the initial stages and everything is in a trial. So it is nice to meet people from different countries and have collaborations and know how they have done in their fields, because it is a multi-speciality field here. So we have people from gynecology, we have dermatologists, we have urologists, we have orthopedic surgeons. So it's nice to interact and see how they have been doing in their fields.
Yes, I'm Professor Michael Zocchi. I'm a plastic surgeon from Italy, fully dedicated to regenerative surgery since more than 20 years. And why a plastic surgeon is applying his technology to regenerative surgery? The reason is that since more than 20 years now, we discover the most reliable and the most potent source of stem cells is the adipose tissue. And nobody better than plastic surgeon in the world knows how to treat and to deal with adipose tissue. The adipose tissue is containing a huge number of mesenchymal adult stem cells that are totally different from the embryogenic stem cells that can be the origin of some ethic problems because it is in some way involving the use of embryogenic cells. So I think that the way we approach medicine is rapidly changing in the recent year. With the mesenchymal stem cells, you can really completely subvert the way to treat disease and to regenerate tissues. This is the main difference between just repairing with a non-functional tissue like the scar and replacing and restoring the function and the ideal shape, original shape of tissues and organs. And the regenerative surgery is what we call a transversal specialty because it is spreading their possibility of use in many specialties, from orthopedic surgery, rheumatology, dermatology, plastic surgery, wound healing, and even with the delivery of this product in intravenous way can be used for systemic disease. Some legal issues still exist in the most important country, in America, in European community, and for sure also here in the Eastern country. We need to respect rules and regulation. As a scientist, it is a major obligation for us. This is the reason why we develop technologies that still remaining within the frame of the legal rules at the present time active in all these countries. We can still enhance the possibility of the tissue, grafted tissue, to enhance the capability of repairing and regenerating. I think that medicine is completely changing. In the future 5 or 10 years, we are going to see a new age of medicine that it will be based in the complete recovering of the original functional status of the damaged tissues and organs. It's for me a great pleasure and honor to be here in New Delhi and sharing with colleagues from all over the world and with the Indian colleagues our experience, and has been for me a great honor to have the opening lecture on this specific topic. Thank you very much.
Keep watching A1 News TV for more such news updates.
ताज़ा तरीन खबरों को जानने के लिए अभी टाइप करें A1 News TV। नीचे दिए गए सब्सक्राइब बटन को दबाएं और नोटिफिकेशन के लिए दिए गए बेल आइकन पर क्लिक करें। हमारे वीडियोस को लाइक, शेयर और कमेंट करें।